Hi, everyone, and welcome to the MDH Stroke Program Monthly Education Series. With Stroke Awareness Month of May just around the corner, we wanted to share some stroke awareness resources to give you some ideas on what to consider this year. But most importantly today, we are excited to turn it over to our special guest presenters from the Minnesota Stroke Association, Katrina Meyer and Dr. Cody Wendland, who will share valuable stroke survivor resources and personal experience. Next slide. Before we get started, let's cover a few webinar reminders, stroke program updates, and today's objectives. Today's webinar is being recorded for future viewing. Therefore, your lines have been muted upon entry. So unless you are presenting today, please kindly keep your line muted. You can interact with our presenters in other ways today by using the WebEx features. You can share a reaction by clicking on the smiley face. It will give you some emoji options, or ask questions by typing them in the chat throughout the presentation. Please make sure to select everyone in the chat box so we can all see it. We will keep track of any questions and we'll try to address them at the end of the presentation or within the webinar follow-up email if we just can't get to it today. Next slide. Well, the grant finally posted. Our team is uber busy reapplying for the Paul Coverdell National Acute Stroke Program funding. We are only one of 13 states that currently receive this funding. You may hear from us asking for letters of support or partnership if you haven't already, as this is one of the primary funding streams that supports the Minnesota Stroke Program. We may be pretty busy during this time, so appreciate your patience if we are a little late responding to messages. Attention stroke coordinators. Our stroke coordinator half-day workshop, Thursday, May 23rd in Brooklyn Center is free and open for registration. The workshop will be a great way to connect with other stroke coordinators from all across the state. And just a reminder that we will be hosting another coffee talk session with Chris Kleckner on April 23rd at 10 a.m. We will be chatting about social determinants of health and life's essential 8. If you need any more information about any of these events, please contact us. Next slide. In today's presentation, I will share a snapshot of the many MDH stroke awareness resources and activities to help you plan for the month of May. Then I will turn the presentation over to the Minnesota Stroke Association. Katrina Meyer is here to share additional resources and stroke awareness events. Dr. Cody Wendland is here to share his personal story with us, his experience with stroke as an ED provider. Upon completion of today's webinar, you should be able to access MDH stroke awareness campaign resources, identify common needs post-stroke hospitalization, describe free community support services offered to stroke patients by the Minnesota Stroke Association. Next slide. The Every Second Counts Stroke Communications Toolkit, as I mentioned, houses a wide variety of awareness strategies and materials and are in the form of graphic files that are free for you to download and print in multiple languages. We have a lot of resources in English, Spanish, Hmong, and Somali. Next slide. Here's a peek at what the images look like. There's an infographic, newspaper ad, social media graphic. Oh. Next slide, please. Here's the peek at the images, infographic, newspaper ad, social media graphic, billboard, poster, and bus ad. Each image has a place for your organization's logo or website, and each image has two versions, one with and one without the MDH logo. This really makes it easier for any organizations that have difficulty or any barriers on co-branding. So you can certainly use these images in all of these graphics and just put your own facility logo in there. We also have BFAST magnets available. Please reach out to our team if you would like some for your program. Next slide. To access the toolkit, visit our Every Second Counts public awareness webpage and click on the link that says Stroke Communications Toolkit. Next, using that link provided in the toolkit or on the same webpage, find and click the Every Second Counts Toolkit request form. This is the order form to access the free graphic files. And my team here will drop the direct link in the chat for you today for easy access. The form will ask for basic information about your organization and how you plan to use the materials. And once submitted, the form will direct you to a link to a Dropbox folder where you can download any and all of the files to print and start using right away. Please contact us with any questions or help with this. Next slide. Another resource that is new and available to you and your patients are our cardiovascular cardiovascular risk factor reduction videos. That's a tongue twister. They are currently offered in Spanish, and Hmong language videos will, and the Hmong language videos similar to these will be released in the fall. They are short videos covering what the risk factor is and how you can change that risk factor. The website listed here on the screen will provide you with more information and access to the videos. Next slide. Okay, what we've been waiting for. Now I would love to turn it over to Katrina Meyer with the Minnesota Stroke Association. And we are very glad you are here in addition to Dr. Wendland. Thanks, Katrina. The floor is yours.
Thank you. It's great to be here. I am here today representing the Minnesota Stroke Association, which is a sister organization to the Minnesota Brain Injury Alliance. And we can go ahead and go to the next slide. So the mission statement for the Minnesota Stroke Association is to provide support, resources, and information to the 97,000 Minnesotans who have had a stroke, and as well as their family and loved ones and professionals who support them. So we can go to the next slide. What that looks like for us is you all do the amazing and hard work of saving people's lives when they come in with a stroke. And here at the Stroke Association, we are here for that support afterwards of the what comes next. When people have gone through those life-saving measures and maybe that initial rehab and trying to figure out what's next, and adjusting to how life may have changed after they had their stroke and getting back to a meaningful way of life. So we have a variety of programs that I'm going to just kind of lightly cover. And if there are any questions or follow up on any of that, you can feel free to reach out to me. So we can go ahead and go to the next slide. The first one I want to highlight here is our education that we do. We do free education sessions for people who have had a stroke, their loved ones, their great aunt who lives in New Jersey who just wants to better understand what happened to an individual. These classes are open to anyone, and they are free. And their purpose is just to give a basic understanding of the brain, the way it works, and what happens when a stroke occurs. And we have for a long time done these brain injury basic classes that rotate through the topics of kind of the brain injury basics, adjustment after brain injury, and caregiving in brain injury. And we added in a new class, which is the stroke basics class, which we're really excited about. And it does, again, that basic education, but also really focuses on what is a stroke, what happens afterwards with a stroke, and that secondary prevention, which is so important. And so the registration links are on there. Really encourage you to share this information with caregivers, the survivors themselves. It can be a great way to kind of just plug in and connect with community. And the nice thing about it is it can be accessed from anywhere, so long as you have access to internet. We can go to the next slide. Another program I want to highlight that kind of operates that many people don't know about, and that is our Citizen Advocate program. And as you can see on this slide, there are a lot of activities that this program does, but what it really does underneath it all is it gives opportunity for people to build community and to find their voice, which can be really huge for a lot of people in the stroke and brain injury community when they feel like so much has been taken away from them. And we really support them in finding that confidence in themselves and engaging and sharing their voice. And some important elements to highlight on this. We are nonpartisan, so we're never going to tell anyone who to vote for, or what they should or should not believe as far as what happens in the political system. What we do is we help people learn how to share their thoughts in a way that will be well received by the people that are in office. And like I said, it creates a great community. And since the pandemic, we have operated in a hybrid model. So it is a program that is accessible to people no matter where they live in the state. Even people, we've gotten more and more people from greater Minnesota joining in virtually and engaging, which has been wonderful. Next slide. Our Strides for Stroke is coming up on May 18th. This is a great community event that happens throughout the state of Minnesota. We have official locations for this awareness walk happening in the Twin Cities and Park in New Brighton, as well as St. Cloud and Duluth. We also continue to offer the virtual option for people who maybe aren't able to make it to any of those locations, but want to gather people together and do their own kind of Strides for Stroke walk. And you can take videos and pictures and send that in to the Stroke Association, and we'll post that on our social media and website so that you can be a part of that greater community. It's a really fun event of people coming together. And I also want to highlight that there is no registration fee for this event. And that is done with the intention so that individuals who have had a stroke and maybe don't have the finances to be able to register for a lot of events are still able to come and connect and enjoy themselves. The fundraising is an important element that helps fund our programs, but we also want to make sure it is as accessible as possible. Registration is open for this, and that link can be sent out after this presentation. Next slide. Also, I want to make sure to highlight our resource facilitation program. This is kind of a great catch-all resource. If people want to connect with anything that we do, a good starting place is just connecting with our resource facilitation program. There are some other videos on the stroke playlist of me telling you a little bit more about the resource facilitation program and how to sign people up, so I won't really spend time on that today, other than just giving you all the reminder that the program is a phone support-based program that is absolutely free and helps people connect with the resources that are in their own community to help them access the support that they need for a successful recovery. All right, next slide. We also do create these two different magazines, Stroke Matters and Mind Matters, and they are sent out to individuals who are part of our resource facilitation program. The magazines contain stories of just people's experience with recovery, as well as stories about prevention, different just innovations, events that are happening, and people really seem to enjoy them. People can also just sign up to receive these publications for us for free. Some people like having them in their waiting rooms, things like that. And you can request those by either emailing me or signing up through either of our websites, the Brain Injury Alliance or Stroke Association websites. Next slide. Then another free publication that I know a lot of you make use of is our resource guidebooks. We have our specific stroke resource guide that gives basic information about a stroke diagnosis, as well as prevention and common resources that a person may need after a stroke. And it pairs really nicely with the resource facilitation program because it gives you just enough information to know that there are questions you can ask. So that is a really great resource that if you just want to see one copy of it, to see if it's something that's useful, I can get that sent to you. And we also have multiple ways of getting a larger supply of books to you if that's something you're interested in. And then also just a plug that we have the BFAST logos from MDH in this book in the different languages, which is a fun addition that is in there as well. Next slide. Then we have the unmasking project that we do, which is a great art therapeutic event where it's really kind of hard to explain how cool it is until you actually experience it. But basically what we do is we have these paper masks that we bring to a group of people who have been impacted by stroke or brain injury. And then we bring a bunch of art supplies and say, decorate this mask in a way that represents your experience with stroke. And then away they go, and what comes out is really, truly amazing. We are still doing these mask making events throughout the state. And you can request that we come out and do it. We do free to very low cost for this, mainly just enough to help us be able to afford to get there. And then we also do have a documentary that we made that is, if you have time, really cool. It's about an hour long. It's fun for support groups if you have a support group to watch that as well. Next slide. And then the last thing I want to make sure to touch on is that we do also do education for professionals. We have our statewide stroke professional conference coming up on November 7th. In a few months here, we're going to start doing some recruiting for breakout session presenters. So start thinking of topics of interest, people that you would like to hear from. We would love to hear feedback from you all on both of those areas. And then also I want to highlight, we have virtual lunch and learn series that we do. They will be starting in July. And we have some really great stroke presentations that are going to be happening as a part of that this year. Donna Lindsay is going to be talking about right brain versus left brain strokes. And Joan Soames is going to be doing some presentations on some of those atypical strokes that can come through. We're doing some burnout prevention for professionals. Some working with aphasia, so some really interesting, great presentations, and we try to make those pretty affordable for folks as well. And then I think with that, we'll go to the next slide, and I will pass it over to Dr. Wendlandt, and we can go ahead and take down the PowerPoint.
Hi, everyone. My name is Dr. Cody Wendlandt. I am a physician in the emergency department at Glencoe Regional Health, but today I've been asked to come here and tell my story, not as a physician, but as a patient, a stroke patient. So I will try to keep it a little more personal to try to give the perspective to you guys of a stroke patient and a stroke survivor. So this is my story, and hopefully you can learn something from it and bring that to your stroke programs and the care of your patients. My story was preceded a couple of weeks beforehand by some at-home construction, doing some drywalling, a lot of dust in the air, and a lot of coughing. And it turns out that that coughing is probably what caused the stroke. So probably about a week later, I was working a night shift at the emergency room, and I was completing my shift. And for some reason, I went to one of our nurses before I left, and I said, I understand it's been very busy during the daytime. If it continues to be busy later today, please call me and I will come back to the hospital and I will help out. So I proceeded to go home, And I drove off to rural Minnesota and went to sleep. And sure enough, later that day, I want to say about noon, one of the ER nurses called me up and said, "Yes, Dr. Wendlandt, we're getting quite busy. Would you mind coming back and helping?" So I agreed, and I got showered and got in my car, and I drove back to the hospital. And as I was approaching the hospital in my car, probably as I was pulling into the parking lot, I had noticed that I was feeling very lightheaded and exceedingly dizzy. My eyesight wasn't working well, and it felt like I was going to tip over even sitting upright in the car. So luckily, I was able to park the car. Um, and I walked up to the hospital and I felt like I was intoxicated. And I was basically swaggering about, I'd say, 4 feet off to either side. Again, very, very dizzy, blurry vision, and just very nauseated. So I proceeded to the call room because I was going to be sick. Went to the call room there and found the toilet and went down on my knees and started vomiting. And still, even on my knees and with my elbows braced on the toilet seat, I could not stay upright. I still felt the room spinning around me. I couldn't feel which way was up, which way was down. And it was just too much. I felt like if I continued to try to upright myself, even on my knees, I was going to spin around and smack my head on the wall. So I laid down on the floor and I vomited again on the floor because I was still too dizzy. And it was at this point I knew something was seriously wrong, so I decided to ask for help. And I grabbed my phone out of my pocket and I called down to the emergency room. Luckily, I was in the hospital. And it was at this point I realized that I really couldn't speak well either. I could only kind of mumble a few short phrases. I called down there and I asked for the nurse that I knew was working that had called me in, and unfortunately they couldn't understand me. So they transferred me to one of the other physicians there, my partner, and I said my name, and my partner said, "No, he went home for the day. He's not here anymore." And it was very frustrating because it's like, "No, I'm Cody. I need help." And after a couple of minutes, he kind of understood what was going on. And he says, "Well, where are you?" And I somehow got out that I was in the call room. And so he hangs up, he runs over there with a bunch of staff, gets some adrenaline and picks me up off the floor, puts me in a wheelchair, and I get wheeled down to the ER. Or as I'm going to the ER, they call a code stroke and get an IV inserted, send me down to the CAT scanner. And at this point, again, I'm just exceedingly dizzy. I have to keep my eyes closed the entire time, or I feel like I'm going to fall over, fall out of the wheelchair, vomit. My entire left side was pretty much all but paralyzed. And again, just difficulty speaking at all, just kind of short phrases and grunts. I'm unable to control my secretions at this point either. So some of the things that I was kind of experiencing at that time was I was fully cognizant of what was going on. I could understand what people were saying. I knew that I was having a stroke. I knew all of the implications, the process of what was going on. But I was still just kind of fatigued and tired. And despite knowing the fact that, this was a serious situation, I kind of had a carefree attitude about it. And I don't know if that's just because of the shock to the other part of the brain where I just couldn't fully comprehend it or take it in at that time. But it was a strange sensation to know that something bad was going on. I could understand everything, but still it didn't seem to bother me. So it almost seemed like a bad dream, like this isn't real, but I'm still interacting. So they ended up getting the CAT scan. CAT scan showed nothing. So we ended up getting a CAT scan with contrast, and this showed a vertebral artery dissection, so a crack in one of the arteries in the posterior neck. They got the telestroke doctor on who works with our hospital, and he says, "Well, Dr. Wendlandt, you're having a stroke. And then he started talking about tenecteplase. And as you guys are probably aware, the talk that is given is, you know, if you give this medicine, there's a certain percentage of people who transform into a hemorrhagic or a bleeding stroke, and there's a certain amount of people who actually die from it. And being at that time a 38-year-old guy, I was like, yes, go for it. Let's do it. So I was given tenecteplase, and they said, well, next we're going to call you a helicopter and fly you to the stroke hospital. And at this point, even being a physician, I'm worried about cost because it is not cheap being in the ER nor the hospital or helicopter. Because of the weather that day, the helicopter wasn't flying, so they called an ambulance for me, and the ambulance picked me up. And again, every motion I had in the bed, in the cart, in the ambulance was just too much because, again, my brain was spinning, but my eyes were focused on the steady world, and it was just this mismatch of signals that caused me to be exceedingly dizzy. So I remember being in the back of the ambulance, and I'm still vomiting, and I cannot hold on to the trash can with my left hand because it's paralyzed. So I remember hugging the trash can with my right arm and basically resting my head in there with my eyes closed. And I'm trying to vomit, but I can't because I don't have a gag reflex anymore. So unfortunately, at this time too, all of my family was out of town. So my friends back at Glencoe were busy calling the family and kind of notifying them, and they're booking flights to get back to Minnesota to come check on me. I finally arrived to the receiving hospital, and again, my eyes are closed the whole time. I just kind of feel the jerks and going up the elevator to the neuro ICU, and got in the ICU. And I think at that point, the reality of it hit me that this is something serious. And I started telling the nurse, I said, you know, if I don't survive, please give my sister everything. I want her to have everything. And I said, you're my witness. Please do with it as you will. I got into the ICU, and again, I continued to feel dizzy despite any of the antiemetics that they gave me. It was a pretty uncomfortable experience in that I had neuro checks, I believe initially was every 10 or 15 minutes. So even as I was trying to rest, trying to just relax and take in the situation, every 4 times an hour, a nurse would come in and, why are you here? What's your name? What happened? Please stick out your arms, stick out your tongue, smile at me. And it was a lot. After about, I would say 6 hours, everything just slowly came back, like I was waking up from the bad dream. And I felt myself again. I could move my legs, I could move my arms, I could talk, I could swallow. The only, I guess, symptom I had at that time was a pretty severe headache. I asked for some Tylenol, and the doc says, I'm sorry, you can't have any Tylenol. You haven't passed your swallow study yet. Would you like some Dilaudid? I said, no, thank you. I don't need any Dilaudid. He says, well, you can get some rectal Tylenol. I said, okay, no, we're fine. We're good. Okay. So I laid in bed, and I believe that first night, my neuro checks through the entire evening were every 30 to 60 minutes. And of course, I did not get any sleep the whole night. And it was an odd sensation, basically being treated like an infant as a 38-year-old professional male, that I was not allowed to leave the bed. I could not walk down the hallway. I could not go to the bathroom. I needed somebody to help and escort me everywhere. As you all know, the worst thing that could happen is a fall. Next day, I was greeted by physical therapy, speech therapy, occupational therapy, who could not detect any measurable deficits. I ended up getting an MRI, which better illustrated the dissection in my neck. Of course, I was on anticoagulants, and this was a new experience. After a couple of days, I finally was discharged from the hospital. My folks had arrived in town and they picked me up from the ICU. And on the way back home, we actually drove past Glencoe. And I said, let's stop in Glencoe and let's see everyone. And it was a pretty cool experience to be able to walk in there and talk to these people after the last time they saw me. I looked pretty terrible. Since that time, I had been on blood thinners for a couple of months. I did a repeat CT angiogram about 3 months later, which showed the vessel had healed. Being on the blood thinners was another interesting experience as well. Anytime you cut yourself shaving, worry, even doing activities, you worry about striking your head, knowing that you're probably going to have to go into the ER and get a CAT scan. For the next couple of months, I felt like myself, except for the fact that I suffered from daily headaches. I would be on Tylenol almost every single day, multiple times a day, and at some days I was sleeping up to 18 hours a day. And I think my brain was just fatigued and trying to heal itself. Since that time, I've returned back to the hospital. There was a stint there where everybody loved this story and about how I recovered so well that I was in the right place at the right time. I truly think that that was some divine intervention there, that I had my stroke at the hospital and that I was called to the hospital that day. So this is my story about how Glencoe and Allina and the Minnesota Stroke Program basically saved my life. So thanks for listening.
Oh, hi, Dr. Wendland. Thank you. I hope you have a minute or wouldn't mind opening up for maybe some questions or comments, but I would firstly like to extend a very warm thank you for sharing your personal story with us. Stories, as you mentioned, are a really powerful tool to learn. You can't get more real with that, with a case study. So we're very humbled and thank you for being here, and wish you all the best on kind of your continued journey with this. So at this time, Katrina, I'd invite you to put your camera back on as well. There might have been a question. So feel free to type your questions in the chat for any of our presenters or MDH. I think I saw one earlier, Katrina. There was a question about the stroke walk. The question was, if you created a virtual team, will it show up as a team to join?
Yes. Yep, it should be an option that you can select when other people are registering. They'll be able to select a team to join.
Thank you. Comment here. Thank you for your bravery and sharing your story today, Doctor. And I'll rely on my MDH team too in case there's any questions going just to the host role. So here's a chance to make any comments. Yeah, lots of comments in the chat thanking you.
Oh, there was a question in there about telemedicine.
Yeah, Jody has a question. Yeah, go ahead.
Yeah, out at Glencoe, we are a critical access hospital and we don't have a stroke neurologist or any catheterization laboratories available. So yes, we do utilize telemedicine with stroke neurologists through the Allina Health system. Did I learn anything from a physician perspective? From a physician perspective, I think it's made me want to be the best physician I can be to detect and treat these strokes, but honestly, it's given me a lot of empathy and sympathy for these people when I see them now in the hospital where they can't talk, and I just kind of feel this camaraderie about what they're going through, and I know how frustrated they are. And I hope it's made me a more caring individual in that sake.
And you noted your home hospital, Glencoe. So I think we need to give a shout out here. Being part of the Minnesota Stroke System, and it's an acute stroke ready hospital. The code was activated, and as you mentioned too, you were there happened to be there at the right time. So really interesting and grateful to hear how that all came together. Way to go, Glencoe. Thanks comment from Nikki as well. Okay, well, we'll hang on another minute here in case you had any more comments or questions. The other, in kind of some final closing here, otherwise, we now have a QR code that will direct you to the survey for the contact hour today. You can click the survey link in the chat or scan the QR code to receive the 0.75 contact hour. If you are watching the YouTube replay, please scan the QR code on the screen or expand the description box of the YouTube video, and then you can click on the survey link from there. I haven't seen any other questions come in. So again, I think we'll just do some final closing here. And to Dr. Wendland and Katrina, thank you so much for being here. Everyone joining today, thank you for all that you do. So please stay tuned to your email for our next month's educational opportunity. And I wish you all a great day. And happy Stroke Awareness Month next month.